Thank you. So, the Department of Violence Prevention, we took the approach of basically staying with the mandate of the department. The mandate of the department is to reduce gun-related violence, to reduce domestic violence, sex trafficking, reduce the number of cold cases, and reduce community trauma. Based on that, we developed a strategy that has an intervention that has three components that goes in hand or is aligned with what the public health experts are doing. The first step is PPE saturation. And this is where we ran into a disturbing pattern that despite the fact that we had given out through the department and through various partnerships, community partnerships such as the Alliance for Frontline Healers, the Violence Prevention Coalition, other community groups, we found out that giving out PPE by itself does not change behavior. And part of the challenge in changing the behavior was not so much about the message, but the messenger. So we were able to start, after the first 2 weeks, start focusing on who are the people that can deliver the message, what does the community education campaign look like, and what can we do about testing, not just testing at particular sites, but also mobile testing. Next slide, please. So we put together a staffing from our team, but it's very important to say that these are not the only folks doing the work. These are the people on our team that are aligning or collaborating with other community institutions. 5 direct staff from the DVP that have a long history of direct services in the community. They now work for the Department of Violence Prevention. 16 hand-picked, what we're calling ambassadors, which these are members of the community that at one point that are still at high risk for violence or being perpetrators of violence or victims of violence. They have redirected their lives. They have gone into training. They have gone through a process of redirecting their lives, and we're working closely with them. So they're helping us as messengers to get the message into the communities that are most prone to violence. And then we developed a 4-phase intervention approach, which includes engagement, behavior change, tracking, the curve, and the last phase is what we're calling the re-engaging back with the educational system. Next slide, please. What are the goals? We're extremely concerned that mitigating or flattening the curve has to go along with that we have to be able to accomplish that at the same time that we reduce the number of shootings. During the first 2 weeks of the pandemic, Oakland had a distinctly different pattern than the rest of the country, that for the first 2 weeks, shootings and incidents of violence were extremely low throughout Oakland. That is not the case in the last couple of weeks. Most of the cities across the country did not experience a low like Oakland did. And now we're seeing that in Oakland, shootings are spiking again. And so our goals are to mitigate the contamination by flattening the curve, reduce shootings with injury, and reduce incidents of domestic violence. This is not something that the Department of Violence Prevention can do alone. I think part of this phased approach is to work collaboratively with public health professionals, the medical professional testing groups, etc. So those are the goals. Can we go to the next one? Okay, so as a way of closing, I'd like to make a comment that there are 2 phases to this work that I divide into. One is called, I refer to it as putting out the fire, and the other is fireproofing. What the Department of Violence Prevention is involved in right now is working primarily to put out the fire. What does that mean? Increase the adherence of protective measures against contamination, understanding that social distancing is very difficult for some members of the community. 2, to be able to um, to actually reach the population that we think is most important to reach in order for Oakland to continue to be one of the safest cities in the country. This is not. This will not deal with the longer term issues. This is part of just the immediate response to a crisis. Our plan goes through September, the end of September, and at that point we will continue to adjust the plan based on what our directives are from the Public Health Department. Thank you, and we could take questions afterwards.
Great, thank you, Guillermo. Thank you for all the amazing work you do, and how creative to combine violence prevention work with COVID interventions. That is the kind of creativity that we need in this moment. Our next set of presenters are amazing community organizations that have been doing work on the ground forever. And as you all get ready to speak, a lot of these are particularly for Dr. Noha. I just want to share 4 more questions that we got from viewers ahead of time. Is the county or city doing anything to test non-symptomatic folks? Another one is, how does the city make sure that the Latino population is getting tested? They're the most cases to date. How can residents make appointments for COVID-19 testing by phone? I've seen a website form, but we know many residents don't have computer or internet access. And I said, if you live in Oakland, call 311, or we'll post it in the chat. And then finally, for Dr. Noha or any of our folks on the front lines in the community, I'm concerned with the homeless population in East Oakland, specifically from 73rd and International all the way past 98th Ave. It is a health risk. They need to be housed ASAP for health and safety reasons. So next you are going to hear, I guess I'll introduce you each one at a time. Fabulous Dr. Noha Abuleta, the Director of Roots Community Health. Dr. Noha.
Thank you so much for having me. So I am the founding CEO of Roots Community Health Center. We are headquartered in Deep East Oakland, and our mission is to uplift those that have been impacted by systemic inequities and poverty. And I was asked today to speak about our brand new walk-up testing site, but I will also respond to some of the questions around testing the homeless, since I know that that's a big concern of our community. So we were really proud, if we can go to the slides, please. Really proud to be able to partner with the City of Oakland and CORE and Verily to be able to launch Oakland's first walk-up site. Next slide, please. And it was really important to us that we have a walk-up site because we knew that a lot of our community was not accessing the drive-through sites that were starting to crop up. And we also thought it was very important that the site be located at a trusted anchor community health center that people are already familiar with and already trust. And so we launched officially on just this past Friday, the 8th. Next slide, please. And what we've learned so far is that if you build low barrier access to testing, people will come. We tested 260 people on that first day, and only about half had pre-registered. The other half were able to walk up. So yes, you can go to our website, which is rootsclinic.org. You can call our clinic, you can call 311, or you can just walk up. The flexibility, I think, really allowed for, whoever wanted to get tested, basically to come and get tested. So since we started the walk-up testing, we've done a total of 671 tests in this way. Next slide, please. So some key features are that it is fast. We've gotten it down to an average of 7.5 minutes from the time you walk in to the time you leave. Safe and orderly environment. It's very accessible. People can walk up, and we actually, or take public transportation or bike. We encourage people who actually have a car to access one of the drive-up sites, because this is really, we really want to preserve access for people who are in the neighborhood and who walk up, which many of our patients and members, that's how they've accessed us for years now. So we want to preserve that. It's also free. No insurance is required. We ask about it, but it's not a necessity. Next slide, please. And so we really see this testing as sort of one building block to greater health equity. We're able to connect with people who might not otherwise be connected anywhere. Folks who don't have a medical home are able to come, and they can access not only the health service, but also any other social services or wraparound or legal information that they may need at this time. If they're not connected to a medical home, we can get them connected. And it really is a way, I think, just like Roots Community Health Center itself is a way to sort of overcome the mistrust that I think has been earned by our sort of government and healthcare institutions, both historically and currently. So I'm feeling really encouraged that the site is being so well utilized by our community. Of the tests that Roots has conducted, out of those tests, 44% are on folks of African descent and 39% folks of Latino descent. So we're really proud that this is actually reaching the community that we specifically set out to reach. Roots has been testing since the beginning, really, of this pandemic here at all of our sites, and one of our sites is a mobile clinic that goes out to the encampment. So I just wanted to quickly touch on that. We're working closely with Healthcare for the Homeless and the Public Health Department to test, isolate, and go back and test close contacts at encampments. We also have 2 satellite clinics that are within youth shelters. Same process. We are screening, we are testing, we are then testing close contacts. And so we are being pretty aggressive about going directly to the time and place of need. And we have had people call and even register online for a test who are living in encampments. And because we know our community, our population well, we're asking those specific questions. What encampment do you stay at? If we can't find you there, where can we find you? Who can we call if your phone is off? And so in some ways, the test is the easy part, and the follow-up is the challenging part. But we're really grateful for this opportunity. I think it's a rare opportunity to be able to sort of see a train coming and to be able to intervene and be in a position through all of our partnerships and our collective will and our collective focus to actually prevent disparities that we know would otherwise result. Thank you.
Great. Thank you, Dr. Noha. And I know someone asked, what are these costing the city of Oakland? We have gone out and raised philanthropic dollars to make these testing sites available. So this is not coming out of the city budget. We thank Brown and Tolan Physicians, Blue Shield, CORE, Verily, all have really stepped forward, the Hellman Foundation. So it's really been a wonderful partnership. Next, we're going to hear from Andrew Park. He's the executive director of Tribe, who is doing some wonderful work in the San Antonio district. Andrew.
Thank you, Mayor. Hello, Oakland and the Bay. It's honored to be here. My name is Andrew, and I'm one of the directors at Tribe, a nonprofit based in the East Lake San Antonio section of Oakland. And I just want to start off by saying that if you logged onto this thing to really, get some help, you've been taking care of you and yours in your section, but if you need some food, some diapers, some PPE, please reach out. We'll have my contact information and Tribe's contact information at the end of this. And just go ahead and sign up, and we'll be out to deliver to you. We were able to pivot pretty quickly because we've been sort of about that work in terms of really listening to the community, listening to our parent leaders. So right when the shelter in place order hit on March 16th, that was week 1 for us. We went from 1,500 pounds of food weekly, produce stands and grocery bags, to 5,000 pounds that week from the food bank. When we saw other nonprofits sort of dropping off because, no one really knew what the shelter in place meant and how dangerous this thing was, and everyone was playing it safe in the beginning, our parent leaders just kicked into gear and said, families are scared, they're hungry, they're immediately going to start saving money. People are already getting laid off early as March 16th. So we went to 5,000 pounds of food to 50 families. And now in week 9, you can go to the next slide. We have over 200 families that we're serving a week. 857 families that we've already served, totaling 4,200 plus people, 260,000 meals. The reason why it's 260,000 meals just for 800 families is because we try to give out in bulk, 100 pounds per family. So why? So they can shelter in place. They don't have to go out. They can cook 42 meals for a family of 5 with what we're delivering to them, including diapers, including PPE, including whatever we can get our supply we can get our hands on. This has all been made possible. You can go to the next slide, because it's all about partnerships. We humbly do our work because we constantly run into people that humble us all the time, like Dr. Abalada and Roots, Ibesi, Lotus Bloom, All In, that makes up the San Antonio Family Resource Center here. And we were able to partner with folks like the Oakland Parks and Recreation. Their gyms are closed right now, so we've turned it into a makeshift warehouse with pallet jacks, and we've got like 30 pallets there. They're not all full every week, but our goal is to fill it up and then get that inventory out. Census bags, we have 300 boxes of diapers there that we're getting out that help a mother out. It has got to us. So the distribution has also been enabled by partnerships. How? Who's getting all this food out to people? Well, it's the people that have already had relationships with those that are most vulnerable, most quote unquote at risk. Who are these people? We know these people. They see our people every single day. They're the librarians, teachers, they're the after school program directors, the lunch ladies, neighbors, our parent leaders. They're the ones tapped into 5, 10. We have our librarian at Manzanita who's tapped into 80 families. And he's got a stable of 10 to 15 teachers who do 5 to 8 deliveries, loading that car up with 500 to 600 pounds of food and making that delivery. And when they show up, it's like 1 out of 5 would just start bursting into tears. We see resilience exhibited here, but once a teacher shows up or that lunch lady shows up or that community leader shows up, it's like people can't contain their emotions because of the immense fear. No one's getting evicted, but the rent, the bills are piling up. And, it's this ultimate this approach of we got us. Dr. Cesar Cruz of Homies Empowerment says it's not charity, it's solidarity. Because I always say, like, I'm doing it this week, but next week it might be you bringing food to me. And so let me just quickly end here with some of the barriers, the challenges that we're seeing on the ground. What's blocking some of the love and support to get out there. Everyone's mentioned that it's been the systematic racism that prevents opportunity, prevents resources from getting out to people. But I'm seeing when people mention rapid response, I've heard that more in this past, 5-6 weeks than I have in the past few months. But that rapid response ain't been that rapid because those with power aren't taking risks for those who are truly at risk. We need some courage, and the courage comes from listening to people on the ground who are thinking this stuff through, who are connected, who are out here saying that it's not okay. We're seeing resilience exhibited out here, but that resilience is sort of a facade because underneath it's like a powder keg, and there's all these triggers left and right. And so my main message is there's urgency because it was bad before the pandemic, and our call and mission through this pandemic simply has been clarified and gotten clearer, gotten simpler, and that's to stand in solidarity with our people now for some real hope and real help that can make a difference. So I just want to, just urge all the honorable people that are on this task force, please, let's cut out the middlemen. Let's try to get as much supply into people because people want to help, but it's about releasing some of those resources that are there to get it out to the people as quickly as possible, like these testing sites that are out here. Thanks so much.
Food insecurity. We have been blessed with some great generosity. In fact, big announcement last night that really has a twofold benefit, both to address hunger, but also to address our workers, especially in the restaurant industry that have been impacted. And this is a very intentional racial equity focus. And here to talk about this unique restaurant partnership with the World Central Kitchen is Mayra Chavez, who is with one of my very favorite restaurants in the world, Guarachi Azteca in the Fruitvale. Mayra.
Okay. Hi, everyone. My name is Mayra Chavez. My family owns El Guarachi Azteca. We've been operating in the Fruitvale for over 19 years. We actually turned 19 years while being shelter in place. So when shelter in place began, we unfortunately had to let go of 8 of our 11 employees. And we were operating with just 3 of us, including myself and my mom, who co-owns the restaurant, for about 3 weeks. And then I was reached out by Jose Corona, who works for Eat, Learn, Play Foundation, and also by Sam, who works with World Central Kitchen, by Chef Jose Andres. And basically they asked us, hey, do you want to provide meals for the community? We are collaborating together to help small business owners continue operating in their business, but also helping the community, helping first responders, people with disabilities, seniors, by providing them a hot meal daily basis. And of course, given everything that was going on, we immediately said yes. So we started April 6th, I believe, delivering 200 meals a week to some of these different housing programs and also first responders and High Street RV. And then a month ago, we went from delivering 200 meals to delivering over 600 meals. So now we're close to 700 meals per week. And that has been honestly probably the best thing that has happened to us right now. We went from, only having 3 employees to now bringing 4 more new employees. So it's 8 of us now working there. And it's all been, and many thanks to World Central Kitchen for hiring us and collaborating and partnering with us. So, and our employees are people who live in Oakland, 90% of them live in East and Deep East Oakland. So it's community helping community. And it has been such a blessing for us, to be honest. We have been able to pay some of the bills that we had been, in all honesty, lagging, but now we are paying our employees, but also we are paying bills, and we want to continue doing this. And I think that's something that we have been missing. It's how do we continue to work, not just for us as a small business, but other small businesses in Oakland, especially in areas like West Oakland and Deep East Oakland. So, yeah.
That is awesome, Mayra, and I'm sure you heard the good news yesterday. Last night, World Central Kitchen announced a huge expansion of their efforts centered in Oakland that they believe will benefit 200 restaurants. And there's some pretty famous people that made that possible who are huge Oakland lovers. I don't know if that's been announced yet, but stay tuned. At this point, all of our panelists, our presenters, amazing fonts of information. Before we turn it over and people are going to start putting their questions and comments additional on Thought Exchange, I want to turn it over to our task force members to share their responses to the information that's been shared. If they have any questions for our presenters, now is the time. And so I will start with the co-chairs, starting with Wilma Chan, supervisor, and then I will ask, I'll go down the line of every task force member. If you don't have a question or comment tonight, that is fine, you should pass. We'll have more time for citizen comments and questions. But let me start with Wilma Chan.
Okay, first of all, thank you to all the presenters. Those were really, we have a really great group of people, and it gives me a lot of confidence that the task force will be able to achieve our goals in a short period of time because we're very action oriented. My questions are for Noha, Andrew, and Mayra. What would you need to sustain this effort in a longer term framework? Because I believe this virus will be with us for quite a while. And even though things so-called return to normal, I think we're going to have to be stepping up our efforts and continuing this, say, for another 6 months, another year.
Yeah, I can start. I would say now that testing is becoming more available, thankfully, I think it's really important that across the board, we ask all of our healthcare providers, all of our primary care providers to begin testing more robustly. I think what we're seeing is sort of a mixture of people who can't get tested where they normally would go for their primary care. And this is going to sort of put disproportionate burdens on the sites that are really designed for people who are not connected to care anywhere, or for people who, really are from that surrounding neighborhood. So it has been challenging. I think all of us have had to revise our testing criteria 10 times since this started. It feels like yesterday where you had to have just gotten off a plane from somewhere that had a lot of it. And now we're at the point where I think we can really begin offering testing to anyone who's symptomatic, anyone who's been in contact with someone who has it, and anyone in a high risk group, and anyone from a high risk setting. And I think if we can open up testing across the board, or at least resource it such that everyone can get access, I think that will help to keep the sustained sort of testing going.
I'd just like to jump in. Thanks for that question, Supervisor Chan. One of the things that we've tried to kind of evolve that question a little bit to say, how can we sustain this, but how can we come out of this before better than what it was before we started, because it was really bad before. So we're talking about this food supply. I've been thinking a lot about it. So, how to have some land for folks to be able to grow their own food, and we can start that right now for our youth. We're getting, little tomato plants for them, just teaching them young. And then, talk about violence prevention. This virus is clarified stuff that we can't do stuff as we did before. So I've been with Peter Kim's team and Oakland Unite, getting out into the streets. Here in the Dubs, there's hundreds of people gathering for things, and we're engaging them on the street with the PPE. But we're realizing, we can't be on opposite sides looking at old models. This virus has enabled new ways for us to talk to people in a way that's hey, look, put on that mask because we love you, we care about you. But then also let's have a conversation after this about your street memorial, and then the neighbors too as well. Let's somehow get together on a Zoom call with your cell phone and let's start speaking to each other. Whereas before there were these barriers. And so we're trying to think through ways of we don't want to sustain and just keep going with what we're doing, but we're also trying to think through what are our folks on the ground saying, and really trying to listen to them, because it's almost like we would be continuing the conditions that were bad prior to COVID, which is super bad. You know that, Wilma, and you've been in this work with us. And so how do we almost use this crisis as an opportunity, dare I say, to come back on the other side a little bit better than we are right now?
Great.
Thank you. In fact, that is the second goal of this task force, is to use this moment of national attention and awareness to make permanent systemic change. I will now move to Dr. Tony Eiton, co-chair.
Hi, everybody. Yeah, what a wonderful panel. I'm super inspired by the incredible work happening with such leadership in Oakland. I want to praise you and thank you for the work that you're doing. My question is, in addition to, how do we do more of what you're doing? How do we support you to do more of what you're doing? Is really around the Oakland check-in, the Great Oakland check-in. It's my belief that the way that Oakland gets through this is through being connected, people being connected to each other. This is going to require, a deep and lasting effort in what we call social cohesion. People coming together, recognizing our shared destiny, that we're all interconnected and that we all have to protect each other. The check-in has done amazing things. You've reached 2,600 people. There are probably, 100,000 people in Oakland that could benefit from this kind of check-in. What are you projecting for getting to kind of like the level of phone calls and check-ins that you think you need to get to in order to really make sure that we blanket this love across the communities that are most impacted?
Thank you so much. Some of the challenges that we've run into are the digital divide just amongst volunteers themselves. So needing to have some, training in terms of how to use the app that we're using in partnership with the census to reach the folks that we're trying to call. The app itself that was given to us from the state that has all the phone numbers was originally a canvas knocking on doors app, not a phone app, which we had to adapt to given the COVID environment. So these are some challenges that we've had to surmount, help each other get trained up, also add additional volunteers as they come in to really start to make those calls. And then, the city workers as well, they have had some tech challenges with different devices, but some have come into the libraries to make some of their calls. I think going forward, as more volunteers come on, get trained up, they'll also be making calls. So I do see us reaching some of our goals to reach out to people. But I just want to say, this is something that in the future we could think about as happening, either once a year, that the county and the city and others make these calls, check in on people, not just after something traumatic, like say the Muslim ban, right? But just annually, how are folks doing? Because we know that our city programs, our county programs only reach a limited subset of our vulnerable population. So this is a way that we make calls through the data that we've been given, but also through our trusted community-based organizations like the one that Andrew leads, right? Where they also make calls through their lists and their neighbors. So just, we're still facing some of those challenges, but I do feel like we will surmount them. And then also that it really, what we learn from this is going to be so important for how we engage community in the future. And it's got to be coordinated, and it's got to be collaborative and through partnership and substantial. I mean, we should be investing in this type of effort every year, not just companies trying to sell people things, right? So that's what most of these residents are afraid of. They're afraid of getting a scam caller, someone trying to sell them something. Or, someone just trying to research and ask them a question or poll them. But we're actually checking in on them and connecting them to resources. So that's my hope. I'm not sure if that answered your question, but I will say one other thing, that we do also pair this with media that goes into these communities, especially Black and Brown communities. We have PSAs speaking the different messages about testing, et cetera, and resources on KVLX. I've actually brought in some city workers to share testimonials, as well as young people, people from the community who will be also sharing these messages so that we can get more people and connected.
Great, thank you. Thank you, Dr. Eiton. You are amazing. And next, Assemblymember Rob Bonta, do you have a question or a comment? Rob? All right. Rob, you're muted. Unmute yourself.
Am I now unmuted by the host?
Yes.
Okay, hi everybody. Sorry about that. That's my biggest challenge these days is being unmuted on Zoom. I just want to thank this incredible panel. I appreciate all of the folks on the ground doing incredible work, sharing your perspectives, your experiences, challenges, as well as all of our experts who have convened together to join in our common path to look through an equity lens and turn our passion into action and make a difference in Alameda County, in Oakland. I do want to really uplift and appreciate the incredible modeling work in Oakland and in Alameda County. And I have a question, and it is this. It's for our directors Chawla and Watkins in Alameda County. I really appreciated your presentation, and I was looking at some of the data that you had regarding the disparate impacts on some of our communities, in particular our Latinx community. And I noticed that the bucket for Asian Americans was Asian. And I've done a good amount of work on disaggregated data, more granular data. I believe that disaggregated data is good data, it's accurate data, it's reliable data, and sometimes you can reveal things that have been concealed and render visible things that were invisible beforehand when you pull out that disaggregated data. I recently heard a presentation around Native Hawaiian Pacific Islanders perhaps being the most disproportionately impacted community in many states with respect to COVID-19. So can you comment a little bit on the importance of disaggregated data in Alameda County and beyond?
I maybe can start and I'll turn it over to Kimmy after that. I totally agree with you. And the way that we get our data on tests is from providers. So healthcare providers this is a reportable disease, and healthcare providers are required to report the specifics of the diagnosis to the public health department. And what we found is in the beginning, we had a large number that did not have complete information. And what we're finding as we go back and try to fix that is that some of the information that we've gotten has also been incorrect. And so specifically in the Asian population, we found that people were miscategorized in the subsets of the Asian population. So we're trying to go back and address that, and creating reminders to our providers that completely filling out the reporting form is critical to having us understand the impact of the disease. So it's mandatory under health officer orders that they complete that information, and we're going back and trying to fix it. I don't know if Kimmy, if you have anything else to add there.
What I'll add is that being able to disaggregate the data is absolutely important, because without that information, we can't make course corrections in the direction that we set in the interventions. And so to the degree that we have data at the level that we needed to really inform where communities are falling through the cracks, where we're missing people, that's an important part of what we need to be doing, and continue focusing on that. Thank you.
Thank you. Thank you. Now, I do want to move on to the rest of our task force members. I'm going to ask task force members to go down to participant in your Zoom and raise your hand if you wish to ask a question or share a comment. And while you all do that, I'm going to ask to share a slide on the criteria for reopening the county. That was one question we got ahead of time, and we have a good slide that shows a summary of where Alameda County is relative to others. And while we do that, I am going to wait for someone to raise their hand. In the participant bar. I am not seeing it right now. I'm going to go ahead and call on Council Member Lynette Gibson McElhaney. I know that you will have something beautiful to say. Council Member McElhaney.
I can't. Thank you. I was going to say this, not allowing me to unmute myself. Good evening, Madam Mayor and everyone. I'm so heartened by the work that's in front of us now, and to see everyone here to lean in on this critical discussion. The framing remarks that have been put forward by Director Flynn, I think, give us an opportunity to really think about not just looking at how past practices have led us to this day where we have vulnerable communities that are Black and brown or are poor or vulnerable. But in this very moment, we are invited to say we can re-envision a city that is just. And we can use this moment that is so filled with pain as an opportunity to invite more love, more care, more realignment of our resources in a just and equitable way. I know that we are just really at the beginning of feeling the effects of the pandemic as our medical crews catch up with treatments and vaccinations. But I am so hopeful that we have, Madam Mayor, with your leadership and the co-chairs, pulled together the very best thinkers that will allow us to get our arms around this and to do it rapidly in all three phases, this immediate response, and then how we're going to emerge in recovery. And I'm looking forward to that not being a story that continues along the lines that we've previously lived, where we continue to talk about the systemic and historic inequities, but that Oakland will continue to do what we do, which is to set a platform for how we redress these inequities. And we are the just, loving, equitable society that we all know that we can be.
Thank you. Thank you, Council Member. Next, we have a question from CEO of La Clínica de la Raza, Jane Garcia. After that, I'll call on Dr. Quach from the Asian Health Services. Jane Garcia. You should be able to unmute yourself in the bottom left-hand corner.
I used it all the last time.
Okay, can you hear me now?
It is true, and I stretched
Can you hear me
out.
now?
Yes, although let me. And if not, the participants, the host will do that.
Mayor, for some reason, it's not allowing her to unmute, but let's see if she can text one of us at this point. Sorry.
Dr. Quach, can you unmute yourself?
Yeah, can you hear me?
Yes, yes.
Thank you. Again, just want to appreciate everyone for all of the information that you shared, and also to Assembly Member Rob Bonta for bringing up the disaggregation of the AAPI communities. I actually had a question for Guillermo and anyone else that can answer. We have seen at Asian Health Services, but also in our community in Chinatown and throughout Oakland, the rising anti-Asian hate crimes. A lot of times they're going unreported because of the fear in immigrant communities. And I'm just wondering what efforts are being made to encourage reporting, and also from a prevention point of view. Our communities are scared, our staff have witnessed so many people that have been beaten up, vandalized, even communities where they're wearing masks to protect themselves and others, and they're being attacked and harassed around it. So just wondering what efforts are being made about that.
Absolutely. I think that one of the things that we have been at this point discussing a fair amount, is precisely that point, and whether some of the same strategies that we're using to build community cohesion can be applied or should be applied in this particular instance. It's hard to be optimistic at a time like this, but I do think that the COVID-19, for many years we've looked at violence as a contagious disease, but we could, if it was happening in one part of town, we could avoid it, or we could think we can avoid it. And what COVID-19 has done is that it really is evening the playing field, in the sense that if anybody in the city is infected, everyone is in danger. Likewise, the same thing happens with hate crimes and violence, that we really do need a broader city approach that includes not just, it includes all populations. So how soon would it be before we roll out a specific strategy directed at reducing the violence that we're seeing directed at the Asian community? We are in the process of planning. And we're in the process of figuring out what resources, as you know, the city right now is in sort of adjusting all of its resources. But you're right, you're spot on that we cannot, we cannot allow this to continue. So I think we do know some things about reducing violence at a community level. And I think it's a question of applying those strategies across the board. I think there are highly respected colleagues on my team that have been very insistent that this is something we have to take on. So I hope we can stay in contact as we move that strategy forward. And I think it's going to take a kind of a broader group of people than just the Department of Violence Prevention.
Yes, and I know early on, actually Congresswoman Lee, Assemblymember Bonta, Supervisor Chan and I held, I think, 2 press conferences to absolutely decry the hate crime, the discrimination that was unfairly being centered on the Asian community. We welcome your additional suggestions. It is absolutely intolerable and unacceptable. For those of you who can't figure out how to raise your hand as a participant, you can also put something in the chat. I will call again on Jane Garcia. Were you able to unmute yourself? All right, we're going to come back to you again and try again. Kim Rhodes, Dr. Rhodes has a question about testing. Dr. Rhodes.
Good evening, Mayor Schaaf, and thank you to the presenters for making me feel really proud of my city. I just had a couple of questions that sort of are tied together around testing. The first is, I was wondering about the availability of antibody testing, which is much less sort of invasive and noxious for participants. And then the second question I had really reflects on thinking forward to what is going to be for the next couple of years, probably the fastest growing sector of employment, which is contact tracing, and wondering about, thinking how to fold that into some to actually do some of the, and where they are familiar with the folks that they would be door knocking and collecting data on. Thank you.
Thank you, Dr. Rhodes. I'm going to take a stab at the testing question to build on what Dr. Abalada had stated earlier, and then I know Kimmy can answer the question about contact tracing. As it relates to testing and the antibody tests, right now, still the antibody tests are not widely reliable, and until we have broad testing for the virus in people, we don't see a time that we move to antibody tests. Widespread use of antibody tests in a population that has a relatively low prevalence of the virus is also not very accurate, because the tests themselves are not very accurate, providing false positives or false negatives. It can give people an unreliable sense of ease or concern. So right now we're really focusing on providing virus testing for everybody who is symptomatic. And I know somebody asked earlier a question about asymptomatic testing. And once we're able to test people who are symptomatic or people who are in high risk occupations or high risk conditions, moving to asymptomatic testing will help us get community surveillance, understanding what the prevalence is in our community. But right now, it's a bit too early for the antibody test to figure into that equation. I'll let Kimmy answer the question about contact tracing.
Thank you for that question, Dr. Rhodes. Yes, it is our intention to include people from the community in our new contact tracing model. As I mentioned before, we're looking at a hybrid model of community and county working side by side on teams. And we are hoping to have people of all ages. I think a lot of our panelists talked about the mistrust that's out there about not only testing, but also the whole process of having strangers calling your house, asking you very invasive questions. And it will be a lot more impactful and effective if we're able to engage and employ through organizations and other employers, people who actually are from the communities that we're serving. So yes, we are absolutely looking at that.
Great, thank you. Any other questions, Dr. Rhodes? Great. I know that Congresswoman Barbara Lee is doing the important work that she must do in Washington, D.C. Exciting vote tomorrow. I think Tatiana Kalinga would like to share some information about what Congress may hopefully be doing tomorrow. Ms. Kalinga.
Thank you, Mayor. Just wanted to say a quick thank you to Mayor of Oakland staff, Alameda County Department of Health for your amazing work and leadership during this COVID period. Unfortunately, I'm here on behalf of Congressman Lee because we are heading back to Washington for votes tomorrow on the HEROES bill. And so we just wanted to just note something quickly that kind of came up in the last set of questions, that in this bill, particularly in regard to testing and contact tracing, the Congresswoman and other members of Congress have allotted $75 billion for a national testing and tracing fund. And specific to that, the fund would be allocated to, and it requires health agencies to connect with established community health-based partners to go out into the community. So we're looking, and thank you to feedback and groups and meetings and calls that we've had over the last, especially 2-3 weeks or so, in order to kind of help draft that legislation. So please contact our office, send us emails, calls, so we can continue to update and garner more information for the next round of package bills. So thank you, everyone.
Great, thank you. I know that Yvette Radford has a quick question and maybe suggestion about contact tracing for Kimmy.
Yeah, hi. First of all, I wanted to thank all the presenters as well for the great presentations and for all of your hard work. And actually, I think my question was answered, Kimmy. It was really about, could you expand on your plans to ramp up to the 300, and about, whether or not you were exploring opportunities to partner with employers and other community-based organizations. And I think you addressed the question about this as an economic opportunity and economic security strategy. And I think that that's a great idea.
I want to also just highlight that we are also looking at this as an opportunity to be able to employ displaced workers from the communities as well. And so, yeah.
Great, thank you. I want to recognize Councilmember Taylor. Says he's not going to ask a question because they've been answered, and he wants to give more time for the public questions. I think Jane Garcia now, third time's a charm. Your question, please, Jane. I thought third time was a charm. Jane Garcia, can you try and unmute yourself? Bottom left-hand corner. Oh, Jane, you can try texting me your question, Jane, and I will try and answer it myself. I do want to kind of last opportunity, put yourself in the chat or try and raise your hand. If I know many of you want to hear from our public, but James Harris, Natalie Aguilera, Gabriela Galicia, Michael McAfee, Supervisor Keith Carson. I think Natalie Aguilera has a question. If you can unmute yourself in the bottom left-hand corner.
Hi, good evening. My name is Natalie Aguilera. I'm Choctaw and I represent the Native American Health Center. The Native American population is not large in size, but in the Bay Area and Oakland, it's home to one of the largest urban Native American populations in the US. But because of our population size, I noticed that our data is sometimes either unreported or not reported at all, or we're included in the other category. So that although our population is not large, it's important that we continue to be at the table. So thank you, Mayor Schaaf, for inviting me to participate today. But just like other communities discussed tonight, our community has been severely impacted by chronic conditions. And as you've probably seen in the news, hit very hard by COVID. As you can imagine, our community suffers from historical trauma around infection and disease going back to 1492. And it's at times like this that our support systems like expanded mental health and services focusing on the social determinants of health are so critical. We are committed to supporting our community. We are doing targeting outreach to the Native American community in our area. But it's critical that we continue to be at the table. So my question is really around the data. So maybe this is for Colleen and Kimmy. If you have data that you could direct me to, because when I've looked through Alameda County or City of Oakland, I haven't been able to find it. But again, just to put it out there that our members know and trust
our dashboard to see what it said. And I see that there's quite a lot in unknown race and in unknown race. And so I think that what you point out is really important. We should look to see if we can disaggregate it by the Native American community. And, you know, as you also point out, often when there are fewer than a certain number of people, we try to protect confidentiality. We don't report it, but it's important that we continue to track it and use it to learn from. So I'll make sure that we look more closely at that.
Thank you.
Great, thank you. I know that Gabriela Galicia from Street Level Health Project has a question. Gabriela.
Thank you, Mayor Schaaf and all. So my question really is in regards to our Street Level Health Project really supports the undocumented and immigrant communities. And so my question is really about economic security. As we all know right now, one of the communities that is being hit the hardest is the undocumented community because they are being left out of a lot of benefit programs, economic relief, and reason why a lot of our organizations have started relief programs, but we know this is not enough. And this is also just a one-time deal. So how is the county and the city looking at really protecting the most vulnerable and creating economic security for the long term in terms of this community? A lot of our community members on our phone calls weekly, we are doing the same thing that the City of Oakland, since the first day of shelter in place, we started doing wellness checks with our community members, and a lot of them fear that after the shelter in place is lifted, they may be evicted, they may be homeless. So we are concerned that we don't want to see a growing population of homelessness, in particular in our communities that we serve. The second question is really about the Hmong community. So as we're looking at the Latino population and the data that we see here, we also have to think about disaggregating this information because the indigenous community is a large growing community here in Oakland, and in particular in the 94601 zip code and 94621, where there is the highest cases. We're seeing a lot of Hmong community members that are calling us that are COVID-19 positive. So how are we working to do that? How is some of the contact tracing going to be done by this community? And how are we implementing more testing for some of these other communities that are being left behind?
I will just speak briefly on the City of Oakland. We have, through our fundraising for our relief fund, tried to contribute to organizations that are specifically serving undocumented through the R fund at Centro Legal de la Raza. And we will continue to try and just spread the word, and trusted organizations like yours are the ones that people will trust. People, they can trust that. When we connect people who are running small businesses, our partnership with Kiva.org, you can be a undocumented small business owner and get a loan through Kiva. I don't know of any other lenders that are doing that. So just anything from Alameda County or the City of Oakland, all of our food programs are absolutely, we are trying to make the undocumented community feel safe because I always like to say that we are the most unapologetic sanctuary city. Colleen, do you want to talk about the contact tracing and the Hmong? And I want to thank you, Gabriela. You participated in our town hall that was in both Spanish and Hmong, and we have recorded that if anyone else can make use of that. It's particularly important because Hmong is not written. So, Colleen.
I'm going to turn it over to Kimmy because I think she knows more about this than I do, but I do know that we did some specific outreach in Hmong and created messaging in messaging videos, I think. Kimmy, I think, knows more than I do about this.
Yes, we have developed a few PSAs that were done by one of our staff who are mom speaking. But we also are really looking to partner with you all, Gabriela, as we have done in the past, to reach the mom community. And we do know that there are increasing cases in your community, and so we are relying on the partnership to engage and to make services available and to serve.
On
Great,
the, I just want to briefly say on the immigration question, go to our social services page. We have questions and answers regarding what benefits that undocumented immigrants are available to them. So, and a lot of facts, because undocumented are able to get some benefits, none of the federal ones, but there are some state benefits and others that you should apply for. And there are also some free legal aid attorneys listed there that you can talk about your individual case, especially if people are in mixed households.
Great. And also Keep Oakland Housed, keepoaklandhoused.org or 211. You can connect to Keep Oakland Housed, is helping people maintain and stay in their housing, including with emergency financial relief. And we are trying to especially reach out to the undocumented community. Recently, the Unity Council was added as a partner in that. At this point, I want us to put up the thought exchange, the questions that came in from the public. The most popular ones are going to bubble up to the top. All right. The first one says, please listen. I've worked in hospitals for over a decade and have a background in community development. The focus on numbers and everything won't work. Post the nearest testing location on the store doors and include the need for your provider to report results. Ask your doctor to report results. I will add that we have started posting free testing information on the barriers that we are using on our slow streets throughout Oakland, creative Oakland. And then I believe Dr. Pond has required all labs to report not just positive, but also negative testing results. Colleen, do you want to elaborate on that?
Yes, thank you. And I really appreciate the opportunity to talk about testing again, because I didn't acknowledge all the work that Oakland has done in testing. And I really appreciate that. The testing that needs to happen in our community has to happen in multiple places. And Dr. Abalada referenced that too, about your healthcare provider, about drive-up sites and walk-up sites. And so it's really going to take us all to do it together. So I really appreciate that. And in terms of the negative test results, that's really important. Generally, reportable tests are just positive results, but having those that test negative help us understand of people who are symptomatic and are getting tested, how many are positive. And right now, our range is about 10%. About 10% of people who get tested, and largely asymptomatic people, are testing positive. So that's an important thing to know as we think about community surveillance and the prevalence of the virus in our community.
All right, we have some comments to share. Stores must be required to give hand sanitizer at the door, biodegradable mask and gloves at the door. All aisles should be one-way marked. This needs to be the new norm. Second comment, we need an etiquette change. Access is important. In stores that are open, they must be required to large print post the nearest free testing location. That's a great idea. We will follow up on that. The data is a problem because providers typically do a horrible job reporting, if they report at all. True now and in the past. Can't follow data if it's no good. Very important comment. I think many of us agree, and that's part of our legislative agenda for long-term changes. I live in the East Bay, outside of Oakland itself. Are there food programs in Oakland available for people in need who don't live in Oakland? Haven't worked since, since March 12th. My employer is in Oakland, family size, 3 to 2 kids, can't keep up with the bills, EDD kicked in, but playing catch up with bills. Wilma, do you want to talk about how to find food programs not that are either in Oakland or other surrounding communities?
Yeah, again, go to our social services site. We have an interactive map where you can put in where you live, and things will pop up, including places where you can get food. So you don't have to live in Oakland to get food.
And then, does anyone know whether there are low cost or free thermometers available for those who need them? All right, we will put that as something that is a need that we can look at addressing. Maybe Guillermo's outreach effort can look at that, or Andrew's. Is the mayor's office having any plan for the indigenous families? Any plan to hire people who speak dialect, or a phone line to attend to this community? We do have a translation phone line available to us if people call, where we don't have a native speaker in our office, but we also did a hour-and-a-half resource video in both Spanish and Mum. So please let us know if you want access to that. Maybe we can post a link on the social media to that special town hall that was in Spanish and Mum. In June 2020, Horachi will hire the same, will they hire the same number of employees, or will they have less from the beginning? That's a question for Mayra.
Our goal is to hire everyone back. That is our goal.
And how many, what's the number?
So right now we went from 3 to having 7, so 11. So in total it would be 11.
That is wonderful. The next question is for Andrew. After the pandemic in June and July, will Tribe distribute food?
Yes, our people are burnt out. We usually, take a 1-month break, but we've already been talking and planning. And so, yes, basically the food bank we realize how much supply we've been pushing out. And so we've just been working with them to make it more sustainable for us, to, like, for instance, dropping off the food rather than going to pick up 10 pallets. They're going to drop off 10 pallets to us. So it's our plan to just continue to keep going. And it's dependent on our teachers, our lunch ladies, our librarians, our aides, or our delivery drivers. So we are applying to some grants and trying to get some extra funding for, some type of Uber drop off for this food. But, again, our work is the love and support and the care that comes from people who were already connected doing the drop-offs and kind of having these porch to car, check-ins for 5 minutes, dropping off census stuff, et cetera, et cetera. So we're really hoping to get a new staple of volunteers. Maybe the teachers can rotate amongst each other, but they need a break too. And so we're trying to think through how to make it sustainable so that we don't come out the other side all completely burnt to a crisp and not want, as all of us in the field, we know how we can get to that place irritated. So we're trying,
Thank you, Andrew. Thank you. And I do want to share that Oakland Unified School District sites are going to continue through the end of July. And I mentioned before, the Currys, Steph and Aisha Curry, just donated $80 million to put 200 restaurants to work distributing food in Oakland. Amazing. If everyone doesn't mind, I notice it is 8:00 right now. Can I go for just a couple more of these questions? They're great questions. This one is for Guillermo and Darlene. It says violence prevention and intervention strategies need to be targeted and supported by research in Black psychology. Creating methodology that is successful saves lives. Guillermo or Darlene, do you have a response to that statement?
Absolutely spot on. We have been, not just recently, but for many years, looking precisely at that issue in terms of moving a little bit away from risk factors and really being able to identify protective factors among youth. I think historically, African American youth have been looked at through the lens of deficits rather than assets. And if you happen to be a Black family in the United States, you have, you by very nature have to possess a great deal of resiliency. Very specifically, we're looking at multi-generational transmission of assets as part of that, the work that we know that has been developed by Black psychologists that I have worked with. So we're very much on point with that. I actually would love department in terms of implementation. So if somehow we could exchange information, I would love to sit down and discuss that more at length with you.
Great. No, we will. Thank you. And I have another question here. What steps is Alameda County taking to fund efforts for culturally appropriate, culturally targeted mental wellness and health strategies for African Americans? Importance is relative to the mental health inequalities and undue stress relative to the pandemic experienced by African Americans. If someone from the county can chime in.
Certainly. Thank you for the question. I want to say that in mental health and behavioral health, we see the same inequities and disparities that we see in other places that we've been talking about all evening. And it's critical that the work that we do focuses on our messages on people that are experiencing these disparities and the underlying causes for them. We, as part of the task force work, we understand that communications is and the work with our community partners is going to necessitate mental health messages and mental health messaging through the trusted partners that we have. So it will be a critical element of the race equity work that we're doing as part of COVID-19.
Great. Sharing of information. Lifelong Medical Care is conducting COVID-19 testing for people without symptoms, asymptomatic Oakland residents who are uninsured and receiving Medi-Cal or Medicaid or Medicare. And that is in response to a question. Again, a question about not enough that someone is seeing regarding fighting the hate crime that is being seen in the Asian community. Please call my office. I have a full-time staff person, Sung Kwan Si, that has been working extensively in our Asian community. If there are more things you believe we can do to address the hate crimes, please let us know. Our office number is 510-238-3141. We have no tolerance for this and are absolutely committed to ending any hate crime, any discrimination.
Let's just add that at the county, Keith Carson and I did a PSA regarding this issue, and we're going to continue to follow on it as well.
Okay. Guillermo, how is the Violence Prevention Department removing illegal firearms?
We are trying to first address the issue of who has their finger on the trigger. And I think that the issue of illegal firearms, we have done a fair amount of work with local authorities. And the issue that we have is that, Oakland has been probably leading the fight of the illegal firearms in Oakland are not coming from Oakland. They're coming from outside of Oakland. So we need to do the work that we're doing basically is working at the level of two things: getting the shooter to stop shooting, and two, advocacy work that has to include work with county, and it's more jurisdictional, interjurisdictional than just citywide. We've presented an approach to gun violence reduction in council, and one of the areas that we have a lot of work to do. I think that we've been very successful in many things, but I think it's really important to keep in mind that we have a lot more work to do, and that's one of the areas that we have to do a little bit more of advocacy work at a broader systemic level.
Right. The next question asks, how is Oakland leveraging public facilities to support critical social services now, and what will that look like in the future? So I can say that many of our libraries are turning into food distribution centers. The 81st Avenue Library in East Oakland especially. And my favorite example is we are using our roads. The Slow Streets movement or program has allowed us to open up talk about mental health, access to the outdoors, to exercising in a socially distant way. And people are really taking advantage of Oakland's slow streets. So if you're looking for a place to recreate safely near you, so you don't have to go to Lake Merritt or up to Redwood Park, please go to the city's website, oaklandca.gov. How is the City of Oakland supporting small nonprofits and grassroots organizations doing this work like the Oakland Frontline Healers? In the same way we must support small businesses with the SBA loans, we need to do the same with small nonprofits that are credible messengers. I can say, speaking from the City of Oakland, we are trying to close a $122 million deficit. So funding from the city that was not already budgeted is unlikely to occur. But I have been out hustling fundraising, and we have, through the COVID Relief Fund, supported a number of nonprofits throughout Oakland to do outreach within their communities. And I know that the Violence Prevention Department, other departments are definitely working with credible, wonderful organizations like Oakland Frontline Healers to get the word out. But we will continue to make efforts to try and get that support through the Relief Fund, through philanthropic charity work. But the city's budget is not going to be available for that. Can the task force commit, this is for Kimmy and probably, can the task force commit to having the public health department partner with affected communities for contact tracing? Community health centers, CBOs, contact tracing by the health department comes with serious concerns by communities around deportation and structural violence.
Yes, absolutely. Partnership with community organizations is going to be a critical aspect, a key aspect of our expanded contact tracing effort.
And there's a question about summer camps. Right now, we are planning to do our rec programs during the summer, our rec center, and we are absolutely putting all of the county's orders in place to socially distance and do them in a safe way. So we are planning to do summer camps in Oakland. Stay tuned. A comment, Eastside is a powerful community cultural strategist. Agreed. Oakland, low income and undocumented families, what is being done to provide medical care for everyone? What about undocumented families who may not have a doctor? Low income families. I know I also got a question about what do the uninsured do if they have to go to the hospital. Maybe Dr. Noha Abuleta could answer this question.
Sure. So we know that nobody is being charged for the test. And so as a result, a lot of people are coming out to get tested. And then we are finding that they don't necessarily have insurance or primary care provider. But we do have a wonderful network of clinics in Alameda County that do see folks who are undocumented or who are not Medi-Cal eligible. We're still seeing a lot of people who are Medi-Cal eligible but not enrolled, and so we still do a lot of Medi-Cal enrollment. So if you've just been released from incarceration, for example, or if you've fallen off of your benefits, or perhaps you used to have employer coverage, but now because you've lost your employment, you have nothing, you may be eligible for Medi-Cal. And so we can do that process very quickly, as can many community organizations across the county. So all of the community health centers have the ability to plug people in to get care. And also, obviously, our public hospital system, is available for everybody, irrespective of documentation status. And so I would just say now is not the time to let your chronic conditions go untreated and undealt with. And so the COVID is not the only thing happening. We've been saying it's sort of a pandemic on top of a lot of different epidemics that we're dealing with. So we really want to encourage people to plug into a community health center, get your chronic conditions addressed and controlled, because it will also make you fare better if you do, happen to get this condition, if your blood pressure is under control, your asthma is under control, etc. So the safety net is still open and is still available and is ready to serve you irrespective of your documentation status.
Great. With that, I'm sorry we did not have time to answer everyone's questions. We did get a lot of them answered. I do want to turn it over to my other co-chairs to very, very quickly just talk about next steps and give us your closing remarks. I'm going to start with Rob, then Wilma, then Dr. Eiton. quickly, please. Rob.
Thanks, everybody. Looking forward to turning this into action. A lot of great ideas already generated here. We're going to put in the chat box an API hate hotline at the state level. The PPP program provides support for nonprofits, and we can help you with that. And we need to make sure that contact tracing and any testing does not collect data provided to ICE for undocumented communities. So very important. And these you've provided incredible values and guidance and specifics to help drive our action. And this is a start, not a finish. Look forward to our ongoing work. Thank you, everybody.
Great, thank you. Wilma. Wilma? Dr. Eiton.
Oh, here.
Oh, there you go.
Okay. So I just want to thank everyone for participating. In the next 4 months, there'll be a lot of action. I saw one question about what are we going to accomplish. I think at minimum, more outreach to the affected communities following the Oakland example with the census calls. Number 2, increasing PPE to the affected communities. And third of all, which has been mentioned a lot, increased testing that's easy for communities to get to.
Great. Thank you. And don't forget that we are looking for affiliate organizations. If your organization is doing work that you think is aligned with the goals, please email COVID-19 Disparities Task Force at Gmail. We want to connect with you. Also linked is a survey feedback on this forum tonight. Dr. Eiton, you always say such beautiful and powerful words. Please give us your closing thoughts tonight.
Well, there's just so much to say, and I can't say it all, but I just want to express how inspiring this community effort is. And at the end of the day, we have to save ourselves in this community. We have to stand together. We have to create that larger we. There's nobody coming in to save us. We have to save ourselves. I think Oakland's leadership, which is just so evident here today, is so exemplary. It's setting a model for the rest of the state. I know that because I'm carrying the message from Oakland to various other cities. And I just want Oakland to know how you're inspiring others. So let's keep it up. Let's check in on each other. Let's build that social cohesion. Let's be that beloved community that we all know that we can be. That's how we're going to get through this. We're going to get through this together. Thank you so much, Mayor, for your leadership and for this just exemplary group of leaders.
That was beautiful. So, beloved community, please continue to give us your ideas, your involvement, your partnership. Email COVID-19 Disparities Task Force at gmail.com. Please complete the survey so we know how to improve these public hearings and our work going forward. Thank you for sticking with us an extra 15 minutes, and good night.